Good morning. Today we'll be talking about prematurity and the right to live for those beautiful, innocent children. And we have with me today a very experienced pediatrician who will be sharing her experiences with us. Thank you, Dr. Dosekun, for coming on the program. You are a diamond, one of our few diamonds in healthcare in Nigeria. And the amount of work you've done, particularly in this area, is tremendous. And we're talking today about, the recent World Prematurity Day just passed on the 17th, and we're talking about the right to live. So can you tell us, what does prematurity mean? And when we're talking about the right to live, what exactly does that mean?
Yes. Well, a premature baby is a baby that is born early. That is a baby that is born before 37 completed weeks. And we must always realize that when we talk about preterm babies, there are different categories. There are the very tiny ones, less than 1 kilo. Then there are the babies between 1 kilo and 1.5. And then there are babies between 1.5 and 2.5 kilos. Those are the late preterms. The category that is very worrying are the extreme low birth weight and the very low birth weight. The extreme ones are the ones less than 1,000 grams. And these babies, years ago in Nigeria, like 30 years in Nigeria, 30 years ago, was such a high mortality rate. Most of them died. And so people just assume that once you have a preterm baby, okay, allow the baby to die, and you'll get pregnant again. But thankfully, across the years, things are now getting better. Technology is coming in, expertise is coming in, and we're now realizing that most of those babies we threw away should actually have been given a right to live. And I'm very pleased to say that Lagos State in particular has made incredible strides, both in the private world and public sector, both private and public, not only private hospitals, also in the government hospitals. Premature babies are given the right to live. And we're now seeing, before mortality rate in Nigeria was like 85 out of 100 will die. Now we maybe have like 25 out of the 100 that would die, but they would save 75. So 75%. It's quite good for a low resource country. And I will attribute that to the very positive approach that is now given to preterm babies. Doctors are now getting special training, and nurses, and they fight for these babies to live. Because if you don't fight for them to live, even if they don't, they either die or they become disabled after discharge. So there's a lot of work, a lot of dedication to duty, a lot of attention to detail, to details, to be able to get these tiny ones that have not been well prepared for the world. We're now getting them into the world and trying to make sure they stay alive and they stay healthy even when discharged. So this is a Herculean task, but it is happening in Lagos State.
That is wonderful. Can you tell us, can you share with us, because I know that you've had an arrangement with the Lagos State Ministry of Health over the past few years, and you've treated a phenomenal amount of babies, premature babies. Can you share with us how that public-private partnership, how it worked out, how it started, how it worked out? Because I know you've gone on to a private one now. So, but can you share with us your experiences?
Yes. I think if I am 66 now, I think I would say that 3-year period was the most exciting period in my whole entire life, because it was the first time, at least working as a private sector doctor, that I delivered care without thinking about money. You can't believe how delightful that is. All I was thinking about is this baby must not die. And we had clients from 4 hospitals, Ajegule, Ajeromi, Isolo, and Apapa, that these centers didn't have the bed capacity to look after the sick new units. It wasn't only premature babies, it was sick babies and premature babies. And they just used to stream in. We saw 1,000 babies over a period of almost 3 years. And we gained a lot of experience. We saved so many babies who came to us at the point of death. And the learning experience, the developmental trajectory for my workers was just enormous. You get a young nurse coming within a month, she's acting like a neonatal expert. So it was a very beautiful period for us. We gave our best and our results were commendable. And from that point in time, Lagos State could only afford the partnership initiative for 3 years. Then funds were now a problem. But I would say from that point in time, the Lagos State public sectors, we went through a lot of training and transforming. And after we were pulled out of this initiative, they took the mantle. And I think we now have 18 hospitals in Lagos State who have fairly well-developed neonatal centers, and they're doing incredible work. So I think we acted as the trailblazers for modern neonatal care, and now that baton has been given to public sector, and they're going for it. And I'm so proud of them. I'm sure the present commissioner has heard about this initiative, and I just wish it could happen in more specialties. Yes,
and in more states across the country as well. That would be wonderful. So what else I wanted to ask about was, I know you've just set up a new hospital in Lekki area. Yes. What is it about? Why did you move from there to First Flag? What is it offering the First Flag didn't, or is there anything special about it?
Yes, we just thought, like our name it's Outreach Hospital. When I came back from England, the vision I had was to bring acute care to babies and children all over Nigeria, either direct by we being the service providers or through training. Because sometimes you don't really have to be in the forefront. You can train brilliant Nigerian healthcare workers to deliver it exactly as we were doing. So that was our concept. So we sort of like moved within the Festac satellite or quarter zone. And we now said, no, let's cross the bridge. Of course, again, what to go to a densely populated area, because those are one of our criteria. So we chose Osakpa, and we set up a 40-bed women's and children's hospital there, and with an advanced neonatal center. And we've started again looking after the very tiny babies and having relatively good results.
That's wonderful. So I know we don't have much time left in this half, but can you talk to, because people are listening and they're thinking what causes prematurity? Why do some babies come out premature? And what steps can they do to prevent prematurity from happening? And if it does happen, what should they do?
Yes, I think sometimes when we say what causes prematurity, we actually don't know. At least 50% of the time, we really don't know why this baby decided to drop it. And the feeling is that a lot of these babies is just a fall of nature. Nature has just said, no, this fetus is not right, so this fetus has to come out. It could also be maternal causes. It could be that the mother's uterus, the little bit at the end of a uterus, is not as tight as it should be. So they call that cervical incompetence. So once the weight of the uterus, once it gets a particular weight, it just opens up and the baby falls out. And that is quite a common one. Infection too, whether it's malaria infection or bacterial or viral infection, the mother could be infected, and it now goes, into the baby, and labor is triggered off. Sometimes it's genetic, like I said, the baby has some basic problem in its formation, and that's, the baby is propelled out by nature. So there are quite different causes for sometimes it's even the medical team, the O&G team, that will decide that this baby has to come early because it's dangerous to the mother if the baby stays in. And that is in cases they call preeclampsia, which is a very common problem in Nigeria.
Is there any way to prevent prematurity if it's happening? For a premature baby from coming out?
Well, I think good antenatal care has been found to reduce the incidence of premature. If the mother is well nourished, if the mother is taking the right nutrients, the right micronutrients, she's not overexerting herself. You know, she's in terms of sexual health, she's making sure she's very, careful, and the daddies do have to make sure that they, don't infect the mother with some sexual health problems. I think that would help a lot. And if the mother during the antenatal period has any concerns or any symptoms she has noticed that are a bit different, like some discharge or having some fever or excessive tiredness, she must go to a midwife or her doctor and complain, please just check me up. I don't want this baby to come out too early. And Nigeria is very stressful now, so mothers have to really have the consciousness now, not to overwork themselves when they're expecting a baby.
Thank you very much. Thank you, Mrs. Onitiri, for coming on this program to share your experience with us.
Thank you very much.
Now, can you share with us your journey and your testimony, as it were?
I would like to say having a premature baby is more or less watching the miracle of God blossom. I had a bit of, what will I call it? I wasn't able to conceive for a while, and then eventually getting pregnant, all the excitement, and I was told to exercise a lot and do all the necessary things. I had the apps to monitor and the baby's growth and progress and all of that, as well as my supplements recommended by the hospital I was using then. And basically, I just did everything possible. But at some point, I think I overexerted myself, and with the usual activities, expecting everything to go on fine. And a couple of days after, baby came out.
At what age was that?
The day he came out, he was exactly, from calculations, 7 weeks. Exactly that date, he was 7 weeks. But the doctors were a bit afraid that his lungs weren't developed.
You mean 7 months, not 7 weeks?
Sorry, 7 months, I mean, 7 months.
Okay.
At 32 weeks thereabout.
Okay.
So from calculation, they said it was roughly 7 months, because we always minus plus thing for the pregnancy. So at some point in time, the doctors were like, they're not sure if his lungs were fully developed. And also because of the way I had him in the car on my way to the hospital. So when my water broke, I was shocked, Then my husband, being a medical doctor, I called him and, my water broke. He said that couldn't be possible, because even he, as a doctor, wasn't expecting baby until 9 months, But baby decided to show up at 32 weeks. And
where did you get rushed to? Because we don't have much time, so we need to get.
I was rushed to Bagada General Hospital, and at the gate, his head had already popped out in the car. So they had to attend to me at the accident and emergency. And yes, I had the delivery. Straight, he was rushed into the neonatal unit there and attended to very promptly. And I realized time is a factor when the babies are born that way. They have a certain special kind of care that they need to get immediately they're born as premature.
So where did they take you to? Was it then?
I was separated from my baby at birth because they had to take him to the neonatal ward, and I was taken into the ward because they needed to really attend to him, oxygen and likes, blood samples and all of that. So they did all of those. And then when I eventually got the chance to meet him, he was so tiny. A friend of mine used to call him Shibiobe, that's cooking spoon. He was really so tiny, 1.1 kg. And I was like, oh, it looked like just a soft drink, carbonated drink bottle. So tiny.
Okay. And then they looked after him for how many months in the hospital before he was able to
He was
come home?
He was in the neonatal unit for 10 days because they called him in the ward there. They were rather friendly. They called him Victor because they saw him as fighting for his life and, cooperating. And as tiny as he was then, to get blood samples, I was wondering the needle compared to his size. Even the box of gloves, was bigger than him then. And I was like, oh no, what's going to happen? And at some point, my mother-in-law looked at him and said, children like this, we pack them with cotton wool that had been laced with palm oil just so that they don't fall because they're so tiny. And then, there's the stigma of having premature babies. Some people called him little lizard because he was really, really tiny. And then I just had to care for him. The most important thing was warmth, providing body contact, giving him warmth. I was a bit worried I couldn't breastfeed because I was looking forward to breastfeed. And I had to express milk. And then they had to give him bouts of milk through his nose at first. That's the
tube.
Connection tube, yes. And then subsequently he graduated. His first feeding bottle was a syringe. They had to measure the meals to feed him orally and all of that.
And then as what time did he go home? At what age? Was it 1 month? Was it 2 months?
He went home 10 days after.
That's fantastic. And you were able to take care for him. How old is he now?
He's 7.
7 years old. That's phenomenal. And how is he in terms of school and everything? How is he coping?
Oh my, he asked me questions I don't know. He's very good with quantitative verbal reasoning. He doesn't get less than a 14 over 15.
So it's wonderful. Yes. And that is absolutely great. So if you just stay on the line, I'd just like to, because you were sharing with me some of the things that you do, but I'd just like to go back to Dr. Dosekun. Dr. Dosekun, when the baby is over that initial resuscitation, what's the kind of advice that you normally give mothers when they're taking them home?
I think resuscitation might be the right word, hospitalization and treatment. So it's 1.6 kilos. 1.6 kilos. And we try to ensure that they don't go home on oxygen and they must have established feeding through the mouth, either directly through the breast or using a cup or spoon or syringe or dropper. The advice we give them is that we know that they've left the hospital unit, but now the units they have at home must be like the units. There must be extreme cleanliness and sheets must be changed daily. We give the monitoring the number of feeds the baby has had during the day. We are making sure we document the cleaning time. We make sure these babies are stimulated. I normally recommend to the parents 10 songs a day because these brains are still very young and we need to stimulate the brain and allow the brain to track and grow. Total activity. We suggest gentle massaging during the wash time when we give your baby the gentle bath. We don't like all the elaborate baths. A lot of times it's just a very, prompt. You prepare everything for your bath and you could even almost, clean your baby on your knees with some drape around your knees so that there's not any exposure to cold. Too cold melts away quickly and not grow. So the baby must be kept in a warm and clean and stimulating environment. When the baby goes home, there still have to be trips to the hospital because you have to jointly monitor the growth to make sure baby is not falling in its growth trajectory. We also make sure that the babies have some supplements because it's in the latter months, the last 4 weeks mainly, that the baby loads up a lot of iron, steals it from the mother. lots of calcium, steals it from the mother for its own use. That's what the fetus does, for its use when it's a baby. So we need to give the baby supplements. So we need to give iron, folic acid, and multivite, and also calcium stroke vitamin D drops. And this might have to continue for at least 3 months. There's a specialized type of milk. We promote breastfeeding, continued breastfeeding, and almost exclusive. But in this day and age, there's some addition of some specials. These are specialized formula, different elements that the baby needs to have sort of like an extra bit of. So we give the baby this special premature milk. Baby has to have its immunization. In Nigeria, a lot of times we delay the time of immunization, but it is advised before the baby leaves the ward to have started the Nigerian immunization program. There are some tests that have to be done on these are special babies to make sure that their sensory system have not developed a dent. That's what I call it. So some of these babies, the oxygen exposed too early, and they call that retinopathy of prematurity. So we have to make sure that they are seen by an ophthalmologist to check that they have not started having what they call ROP. Because if you pick up ROP early, you can reverse it with treatment. If you pick it up late, the child may end up being blind. So it is extremely important. So any mother that's listening to this program that has a preterm baby less than 32 weeks that had oxygen needs to go to for ROP test.
Very important.
We also need to test hearing. Yes, we also need to test hearing. There's a simple machine for screening tests called using the autoacoustic emission machine. And that will tell you whether the baby has a hearing problem. The reason why we screen for these tests, these two tests, is because if it's a problem, we can reverse it. So if a child is deaf and you pick it up when the child is still, very young, we can give hearing aids, or later on they can give cochlear implants. So it is reversible. So anything you screen, the reason why you screen is because it is reversible. So please, any mom that hasn't had ROP and or AE test needs to go back to the hospital to ask for where this can be done, so that we don't live with regrets.
That's fantastic. Now, our time is we're actually out of time, but I just want to confirm from Mrs. Onitiri that this wonderful advice that Ms. Dr. Dosekun gave us is actually what she was able to follow, most of it or all of it?
Yes, most of it. In addition, we had to also monitor baby's weight. That was extremely important because weight gain was the primary purpose after leaving the hospital, aside sanitizing all utensils so that the baby doesn't get any infection and you're back in the hospital.
Well, I want to say thank you so much to both of you. Thank you, Mrs. Onitiri, and thank God for your wonderful son. I really thank God for that. I want to say thank you, Dr. Dosekun, for the wonderful work that you have done and you continue to do in Lagos for our children. And I just want to say God bless you for all the lives that you have saved. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.